Hello viewers, this is again your primary or preventive healthcare advocate Bernard, sometimes called Bernard James. I want to speak briefly on this. Why is it that people get surprised when a healthcare personnel is seriously ill, a nurse or a doctor? Why do people feel that healthcare professionals should not fall sick? And they often say something like this, hey, and see papa doctor so yari, hey, and see mommy nurse so yari, that kind of thing. And the reason is that maybe the people feel that it is healthcare personnel that take care of other sick patients, so they should not fall sick. But that is not the case. Yes, the reason could also be that they think healthcare personnel should know better. All right, they should know better to prevent diseases. That's the only logical reason to back that kind of assertion that healthcare personnel should not fall sick, or people get surprised when they fall sick. But apart from that, everybody is at risk of diseases. Whether you are a doctor, whoever you are a nurse, everybody is at risk of getting sick. All right. So do not be surprised if you see any healthcare personnel, a doctor, a nurse who is seriously ill. They are not above disease. The only difference is that, as I have already indicated, they know better. Healthcare personnel know how to prevent diseases. So the doctor falls sick, he won't wait for it to get well. He won't wait to get complication and lie down on hospital bed before taking action. A nurse will fall sick, get malaria. She will not, or he or she will not wait and get complication of malaria like cerebral malaria and be lying out on hospital. No, that's the only difference. So the only difference between the general public and healthcare personnel is that they prevent diseases. And I always say, how do you prevent something that you do not know? All right. And prevention of disease is something that is done at home. Prevention of disease is done by every individual. Whether you are a health worker or not, you have to prevent disease. In hospitals, we don't prevent diseases, as I do say. In hospital, we treat, we manage health conditions. So how can you prevent something that you have no knowledge on? That is why I always advise that even though you are not a healthcare professional, you're not a doctor, you're not a nurse, it is important that you have some basic knowledge on health conditions so that you can prevent, because you are in the best position to prevent disease conditions. So don't be surprised when you see any healthcare personnel seriously ill. They are also vulnerable just as you are. There are healthcare professionals who have hypertension, who have diabetes. The only difference is that they know how to manage them. All right, that's the only difference. So you, a non-healthcare personnel, you have a responsibility to prevent diseases. Know a thing or two about health conditions. Study your body and prevent diseases. That is the best way, and that is the best thing to do.
Thank you.
Subscribe and follow us.